Bismillahirrahmanirrahim. Assalamu alaikum. Welcome to Newsroom. I'm your host Omar Khalid. But today is the 1st of December 2021. The last month of the year begins and we have a lot to discuss with you. Our first story of the day concerns the new variant of COVID-19, otherwise known as Omicron. A lot of warnings have been given, not only at the level of the World Health Organization and the United Nations, but also at the level of the government here in Pakistan, where Asad Umar Sahab has said that it is inevitable that the virus will reach in the next few weeks. At the same time, it has also been decided today that the elderly, 50 years plus, and the immunocompromised will be given the booster vaccines. It has been decided, and of course the people who are the frontline workers as well. The rest, of course, will come in a phased manner, but this is also as a precautionary measure so that there is not much of distribution or dissemination of this new variant of COVID-19. How important is that? This is going to be our first segment. Our second segment, ladies and gentlemen, is the significance of today, that is the World AIDS Day. December 1st since 1988 is celebrated, or of course it is put as the World AIDS Day. A lot of number of patients of HIV or AIDS are increasing every year. Do we understand what that means? Can we take the necessary precautions? What are the measures that the government here locally as well as regionally has been taking? This is what we are going to discuss in our second segment. Our third story, ladies and gentlemen, concerns the Federal Board of Revenue that has exceeded the 5-month tax collection target by 298 billion rupees and has received around 2.3 trillion because of higher collection at the import stage. That has of course contributed a lot to it. Our fourth story, ladies and gentlemen, concerns Pakistan that has been elected as the chair of the Group of 77, which is the largest intergovernmental grouping of developing countries in the United Nations. This was decided in the 45th meeting of the Group of 77 in China, and of course it was held in a virtual format. This was disseminated by the Foreign Office in a statement that was circulated today, and of course our Foreign Minister also addressed the August ceremony. And finally, we will be talking about Barbados that has ditched the United Kingdom, otherwise known as Britain, and Queen Elizabeth as the head of state. Now it has become a new republic starting from Tuesday. It is no longer under the monarchy, under the British monarchy, and at the stroke of midnight, a new republic was born on Wednesday. This is going to be also our last story of the day. Let's begin with our first story, which concerns Omicron, the new variant, COVID-19, the measures taken by the government, and what needs to be done with this new variant. More in the following report.
2020 was a devastating year for global health as the novel coronavirus posed debilitating existential challenge to both developing and developed world. The emergence of newly discovered contagious strain Omicron threatens to set back hard-won global health progress achieved over the past year. Early evidence suggests that Omicron has a higher reinfection risk, but according to scientists, it will take about 3 weeks before it is known how the heavily mutated variant impacts on the effectiveness of vaccines. In order to counter the Omicron threat, Pakistan has adopted a zero-tolerance policy and announced a new vaccination plan under which booster shots will be given to immune-compromised people, healthcare workers, and those aged over 50 years. The nerve center of Pakistan's COVID response strategy, the National Command and Operations Center, called on a meeting which discussed the epidemic curve chart data, national vaccine strategy, and disease prevalence across the country. The Omicron variant is proliferating fast across the globe, and the only protection against it is vaccination and adherence to basic SOPs, including wearing of face masks, social distancing, and hand washing. One key lesson with emergence of Omicron taught is that improving global preparedness for pandemic and health emergencies requires equitable access to vaccines, building resilient health systems, and provision of accurate information to protect populations from infodemics.
Now, to talk more about this, we've been joined in the studios by leading microbiologist and professor of microbiology at the University of Medical Sciences, Rawalpindi, Dr. Usman Javaid. Dr. Saab, thank you very much to have joined us. Dr. Saab, Omicron, should we be afraid of this variant? And is this a more lethal variant than the others?
Thank you very much, Omar, for calling me here. Now, a few basic considerations are, we should not be worried. Rather, we should be concerned that the virus still had shown another mutation and a virus is bound to mutate. The word virus is actually synonymous with mutation. Now it has gone the 32nd mutation this time from the Delta. Okay, now basically we have to keep three things in mind: the contagion, and the epidemiological models carried out in Britain have shown that it is going to be more spreading and more transmissible as compared to the Delta variant. So, and more so in the winter season when the windows are down, the day is short and people tend to stay indoor most of the time, and they are suffering from one or another upper respiratory infection, which makes it more easy for the virus to be transmitted from one person to the other.
There's also the fact that the symptoms are similar between COVID and a normal flu, and so somebody can mistake the COVID for a flu.
Definitely. And the second is the immune escape, which is the most important, that we have vaccinated considerable proportion of the population. Unlike South Africa, where it is only 24%, we have done much more than that. So the biggest concern of the world scientists now is that whether it will remain under the umbrella of protection of the vaccines given to them or not. And let's hope people are saying that as of now, there is no imminent danger that this will fall outside the protection of those vaccines.
When a virus mutates, Dr. Saab, how does that change the mechanism of combating it with a vaccine?
Because the vaccine, for example, in this case, the vaccine was produced again one segment of the virus, that is the S or the spike protein of the virus. So they take one part and then prepare a vaccine. So this time it has shown a mutation in the S protein, one of the genes of the S protein.
And 30 mutations is what I've heard,
32,
if I'm not wrong.
32. 32 mutations in the virus and 10 mutations in the domain where it binds in the human lungs. And the third is the lethality. Now that remains to be seen, and the next 2 weeks will be crucial in telling us and the world, is it more lethal, is it less lethal, or is it the same?
All right, when you say that there is more of a chance of transmissibility of this variant of the COVID-19, what does that mean compared to the others?
Well, if, for example, if 100 particles of the Delta were required to make a person infected, maybe it is 70 or it is 50. It is more easily reachable. It can travel distances longer than what Delta took to make a person infected.
All right. So now we know that Asad Umar Saab has already warned people in Pakistan that it is likely that the virus or this form of the COVID-19 might reach Pakistan within the next 2 weeks. We have started to give booster shots to the elderly as well as to the frontline workers. Do you feel that the booster shots need to be given to every segment of the population?
No, we have again, like we did in the beginning, set out the priority groups, as you said, elderly and the immunocompromised. And then again, you should draw a line that how compromised should the immune system be, because you are again shaking it up by introducing another virus. So it is very important that Asad Umar Saab has said this thing, but we have to make sure that this news reaches every segment of the society. That we are about to receive a new variant, because look at Delta. What happened? COVID was going down very well and steadily in Pakistan till the Delta appeared, and people from UK were here last December on vacation, and then we saw huge spikes. I am afraid this pattern is likely to repeat this December.
All right, now you know, Dr. Saab, that we have banned the travel from 6 African countries where the Omicron cases have been reported. Do you feel this is enough as far as curtailing the spread of the virus?
You consider the number of flights from South Africa, there may not be that much. For people going from South Africa to UK, it has already reached UK.
All right.
And then we will see huge influx from UAE as well. So the doubling time of this virus is 2 weeks, and the next 2 to 3 weeks will be.
What do you mean by doubling time of a virus?
Well, the infectivity ratio that a person infects the other people. For this virus, it is at the moment R is the number which determines how many people will be infected from one already infected. So it is 2. That means one person is infecting 2, and those each of them is infecting 2. That is how it grows. So that determines the doubling time, and it is 2 for this virus at the moment. Till the time it comes to 1 or declines below 1, the pandemic is not going to end.
All right. So we need to be extremely cautious with that, and that brings me to the next question, that is the standard operating procedures, or the SOPs as we call them. The SOPs, how important are they now? The winter is here in Pakistan as it is elsewhere in the world. We've seen a huge rise in the number of cases in Europe, and we've seen that they have done a lot of clampdowns in that continent as well. Do you expect something like that to happen in this region, in this subcontinent as well?
Yes. Now, we have to revert to the situation that was there when this virus entered Pakistan in March 2020. We have to adhere to the SOPs, which you can call the behavioral SOPs or the non-pharmacological SOPs. Again, simple: putting on the mask, keeping the rooms ventilated even if it is cold, and maintaining physical distance and hand hygiene, and not shaking hands. So if we adhere to that, we can minimize the spread of this infection. And as you said about the symptoms, now more alarming is that it does not give rise to fever. People are not coughing.
The symptoms are very different from the others.
It is fatigue and aches and pains. And the bigger danger is that some people say it may not have a domicile here in the nasopharynx. It will go directly into the lungs, which will make the PCR not a very effective test to detect it. People will get results which are called false negative results.
So we need to have an MRI or a scan done,
HRCT.
or an X-ray done even for that.
X-ray or ideally HRCT, but then again out of reach of an ordinary citizen of Pakistan.
So what should an ordinary citizen do if he or she feels that they have gotten the virus or have the symptoms?
Well, fortunately, about 81% of the people will have either no symptoms or minimal symptoms. 14 will have moderate disease, and 5 will have severe to critical disease.
All right.
So now coming back to the NCOC, now that statement is good, but it is not enough.
All right.
We have to delegate it to various educational institutions, the local communities, through the mosques, that people have to be told that, look, we are again back to the place where we were last year, that it is almost time for a new variant to enter. We can defeat it. We can prevent ourselves and our family by adhering to the SOPs which were there till last year.
I've also heard a lot, we've talked about that in various shows before as well, Dr. Saab, that we need to be in more and more of aerated places. We need to go for a walk or need to jog. It's better to do it in an open area, because there's less chance of transmissibility in an open area. Why is that so? Does the virus not spread the same manner?
No. People tend to stay a little distance away from the others. And this physical distance is about 2 meters. In fact, it is 3 feet, but going a little extra cautious, they have decided it to be 6 feet.
All right.
So if I carry the virus and I'm sneezing and I'm coughing and I'm talking and I'm bringing it out of my respiratory tract, if you are 6 feet away, then you are safe. It will fall down on the ground.
Even if I don't wear a mask and I'm 6 feet away, I am safe from it.
Yes.
All right.
Again, if I am having the problem, it is more important for me to wear the mask, because I have to stop the virus from getting out from my orifices.
But as you said, there is a huge percentage that will be asymptomatic, that will not show any symptoms, but they will be the carriers of this virus, which means there is always that chance of transmissibility, even if the person seems normal, in front of me or any other person. In that case, how crucial are the next few months as well as far as following the SOPs are concerned?
Okay, Omar, let me clarify one more thing, that it is not only the unvaccinated which can serve as the source of the virus. If I am vaccinated, I can still spread the virus. The vaccine is protecting me as an individual, but I may remain vulnerable or a source for spread of this virus to other people.
All right. Also, Dr. Saab, if you are vaccinated, can you get the disease again through this variant or any other variant?
Yes, there have been cases. In fact, there was a younger colleague who was working in the intensive care, and he was fully vaccinated. He had COVID once, he recovered. He had COVID again, he recovered, but succumbed to it the third time.
Oh,
yes.
All right.
It happened like that. And surprisingly, again, if you had gone through the news, this variant is affecting the male more than the female and the younger age group.
All right. And what do you mean by the younger age group?
Below 40.
All right.
Otherwise, that was in the previous variants, that was a pretty safe group. That people
exactly, because the first people with the other variants to be vaccinated were the elderly, the 50 plus, and the 40 to
or
50.
They had some comorbidity underlying, like diabetes, heart disease, or hypertension.
All right. Final question, Dr. Saab. When it comes to certain people like epileptics, for example, they are not advised to take the vaccine because there is a contraindication. How should people like those who cannot take the vaccine take the necessary precautions?
Well, then the only option remains is you minimize the exposure till we are again in the safe zone.
All right.
That is
the only way to kind of protect or
because if you
prevent
can't give them vaccine, you can't give them any other medicine, then preventing the exposure remains the only protective measure.
All right, let's hope, Dr. Saab, that the companies also come with a new form of the vaccine that also covers Omicron, and let's hope that because I feel that the way these new variants are coming, that this is not the last variant that we are going to see, Omicron. Yes. We are going to see many others in the years and in the months to come, and we need to be very cautious for that as well. Thank you very much, Dr. Usman, Javaid, to have joined us and to have talked to us about this new variant, the Omicron, and of course the precautions that the government has started to take by giving the booster shots to the elderly as well as the frontline workers. Thank you very much, sir, to have joined us. Let's come with our second segment, ladies and gentlemen, and that concerns the World AIDS Day. Today, the 1st of December, is the World AIDS Day. Why is that day important? Because since decades, this is a disease that has infected hundreds and thousands and millions of people across the globe. Millions have perished, and a lot of people are still living with it, and there are people who are taking the necessary precautions and the necessary medications to live a normal life. At the same time, there needs to be a certain understanding of what that disease is and means to the society, and what kind of precautions do we need to take. More in the following report.
World's fight against deadly viruses dates back to time immemorial, as previously unknown viruses raced around the world and emerged as silent killers. December 1st is a poignant day in global health history as we commemorate World AIDS Day and reflect upon our worldwide response to HIV or AIDS epidemic. Despite this existential health challenge only being identified in 1984, more than 35 million people have died of HIV or AIDS-related illnesses. According to World AIDS Day Organization, there are an estimated 38 million people who have contracted the virus worldwide. Marking this day highlights the need to better protect the most vulnerable communities against this HIV or AIDS, including in conflict settings, small island countries, and global periphery. According to UNAIDS Report 2020, Pakistan has an estimated 183,705 people living with HIV or AIDS, and the HIV epidemic in Pakistan is heterogeneous with diverse transmission dynamics across the country. Pakistan introduced evidence-based HIV prevention and treatment program in the country in 2018 with the aim to increase the coverage of HIV prevention, treatment, care, and support services through a high-impact, focused, targeted approach. Global health community has made remarkable progress in preventing and treating HIV domestically and globally. Despite this tremendous progress, humanity's fight is not finished yet, as HIV remains a threat domestically and globally, with certain population and regions of the world bearing most of the burden and persistent inequalities serving as critical barriers to mitigate this scourge. Being cognizant of this reality, the theme of World AIDS Day 2021 is End Inequalities, End AIDS, which places special focus on regions who have been left behind. UNAIDS Executive Director in her message emphasized that AIDS remain a pandemic. The red light is flashing, and only by moving fast to end the inequalities that drive the pandemic can we overcome it.
Now, to talk more about the importance of how to deal with HIV/AIDS, the importance of the World AIDS Day, and the message that is for this year as far as the World AIDS Day is concerned, and inequalities and AIDS. We've been joined by Mr. Taoufik Bakkali. He's a Regional Director for Asia and Pacific at UNAIDS. Thank you very much, Mr. Bakkali, to have joined us, and it's an honor to have you here for this segment. Sir, does the world understand the repercussions of AIDS? Does the world understand what HIV stands for? Over the decades, we've seen countless amount of fatalities, countless amount of people who live with this disease. Does the world still understand the importance of dealing with this?
Well, 40 years since the first HIV case was found, and 40 years of experience in responding with a lot of successes achieved so far. The world's still learning its way towards reaching the goal of ending AIDS. We have had a change over time in terms of our capabilities to respond to the epidemic, as there was availability of treatment, as prevention methods and models have evolved over time, and as we understood a little bit more who are the people more affected and what's the best approach effective to reach them and to help prevent the epidemic, but the infections, but at the same time also save the lives of those who are infected. But now we know what works. We know who is affected. We know how to do it. But the COVID pandemic recently has put a highlight on some aspects that were not given a lot of attention beyond the aspects of scaling up the efforts and programs and trying to reach. And there are several factors that are not specific to service delivery, but that create all the different aspects that are extremely determinant to achieving a successful response to the HIV epidemic, exactly as we have learned as well with regard to the COVID pandemic. Now, the World AIDS Day team, its complete sentence is end AIDS, end inequalities, and AIDS, end pandemics, because in the context of this year, with the COVID pandemic, we have learned that there is a very strong intricacy, strong linkage, and a learning that we have come that we can achieve by similar approach and similar efforts, a better preparedness to all pandemics, while at the same time reinforcing our way towards responding to the HIV epidemic.
Mr. Bakkali, when you talk of inequalities, when you talk of the pandemic, how much of this is interrelated? Because a lot of inequalities lead to social injustice, lead to a lot of intolerance, and that is what HIV also gives, a lot of intolerance and social stigmas. How does the UNAIDS, along with all the member states of the United Nations, deal with this?
All pandemics, they thrive on the fault lines of inequalities, because the people who face those inequalities are usually the ones left behind, are usually the ones who do not access protection, the ones who do not access the services. And this is why this time it's really important to give more attention that if we need to understand how to respond to HIV and speed up our efforts towards achieving the goal, as we do not have time. 2030 is very close by, and we are far away globally in achieving those goals. We understood that responding and tackling inequalities is key to achieving that. And tackling inequalities means we need to understand who is left behind. We need to understand who are more affected and why they are affected and how they are affected. But at the same time, we need to understand how can we facilitate that they access the services, that they are protected, and the inequalities that are preventing them from accessing those services are also removed. And for this, the World AIDS Day report also talks about these 5 measures that need to be taken towards removing inequalities and tackling them. And there are 5 elements here. I would like to mention them quickly. We might have an opportunity to talk for more in detail. First of all is we need community-led and people-centered infrastructure, because the communities help make linkages to the people left behind. They understand their people, they understand the reasons and how, and there is a certain level of trust. We have seen in COVID that we cannot depend totally on the health system. There is an additional component for health delivery, which is communities. The second component is equitable access to medicines, vaccines, and health technologies. The third one is human rights and laws and policies that had to build trust and tackle pandemics. The fourth one is supporting workers and at pandemic front lines and providing them with the resources and tools they need so that they can reach those more affected. And the last one is data, is the ability to understand what are those inequalities and who are affected and why, and whether those inequalities are economic, are social, are based on design of programs or of any other reasons, but at the same time, the why and how. And these are the 5 elements that are core to reducing inequalities. Now, this theme of inequalities is at the center of the new global AIDS strategy, which has been developed and adopted in the UN high-level meeting.
And there's a report that has come out that your office has also taken out that includes these 5 important elements as well.
Absolutely, absolutely. And we knew this, many aspects, because we see a number of countries who are close to epidemic control, including in our region in Asia Pacific. When you look more in detail, the success in those efforts are also due to the consideration of those 5 measures being implemented.
All right, Mr. Bakkali, when it concerns Asia Pacific, because you're the regional director of this region, how is the success rate of your organization along with the different governments in order to tackle HIV and AIDS?
Well, it's a partnership with all facets of life, and it's not only UNAIDS. It's UNAIDS with the 11 co-sponsors, other UN agencies that go with us under the joint program and help us implement and mobilize for the response. At the same time, we have the governments, of course, but the community organizations, regional and country level, who are key in delivering all the achievements that have been seen so far. The reality is the results that are seen are not equal. There are inequalities even in terms of how much success is being seen in a number of countries. We see in Asia and the Pacific some countries who are very close to achieving epidemic control. They are very close to achieving the 95 targets. And there are countries where we have in this region as well the highest increase of new infections and the highest rates of AIDS-related deaths. Unfortunately, there are different realities that are justifying the situation in different countries, but the solution remains the same, is we need to consider all factors. It's not only considering depending on health system alone, it's not only depending on treatment alone, it's not only by not investing on the laws and the policies that are putting those people behind, or the discrimination. If it is not resolved, we cannot get there. It's really important that we need to consider all these 5 elements, because this is key for us to be able to achieve the programmatic aspects of service delivery.
All right, now the United Nations, sorry Mr. Bakkali to cut you short, 2030 is the year that has been set up by the United Nations as the year when they will try to end the further dissemination of HIV or AIDS. How much of that is achievable? Because you talk about inequalities in different countries at different levels and a lot of issues that you see and you confront in different parts of the world.
We have learned from the previous global strategy, which finished in 2020, where the global targets for 2020 have not been met. in many places. But if we aggregate for regions and globally, we are not on track. That learning helped us understand why we could not get on track, on a fast track towards achieving those global targets. Now, the new strategy renews those commitments. It's not something different. It's a renewal. It's getting more ambitious. But the addition is the understanding how. Now, if the question is it achievable? I can certify it is achievable because we see countries have achieved it already. And if it is done in a couple of countries, it is absolute proof that if we do it this way, we will be able to achieve it globally and in regions and everywhere. And that's the effort ahead of us, is when we understand and know how we can achieve it, we need to follow that path. And it's clear. The report, for example, now clearly talks about the issues of why we are facing those inequalities and why, when we have the political commitment fully declared by countries, and sometimes it's followed up by investments, still the rates of service delivery are extremely low. The people who need to access those services are not accessing it. And that's because in the design of the response in a number of countries, those 5 elements are not considered altogether. And if something is missed, it's like if you are building, constructing a building, and if one pillar is missed, it does not stand. So now we understand in this report that it is achievable, provided that we follow the path that is well described in the Global AIDS strategy, which has put inequalities at the center. There is risk that people can say, yeah, but we may the achievements could be under threat due to COVID. And we have observed that COVID had impacted over the year 2020 on slowing down the progress. But that was seen mostly in the very first few months of 2020, when everybody was trying to find a way and there were lockdowns everywhere. Very quickly, community organizations have stepped up, and we found some amazing solutions that ensured that the HIV response continued to deliver and that people continued accessing treatments and accessing prevention methods. And there was also those mechanisms led by communities and other models that have been established in countries, facilitated access to social protection.
So you talked about communities and you talked about models. Now, how important is it for basic education about what HIV stands for? How can we prevent ourselves from it? And what kind of medicine or what kind of treatment do we need to take if we get HIV? How important is it for the local communities in all of the different countries of Asia Pacific also to join hands with the United Nations and the government in order to disseminate this basic understanding to the common man? Because a lot of people, sir, correct me if I'm wrong, do not have access to television, do not have access to the media, do not have access to maybe internet as well. So they need to be given that information firsthand. How important is that?
Very important, because knowledge is the basis of everything. When any person is able to understand the risks, and if anything happens, what are the options available in terms of at least knowing status, and then accessing treatment if needed, or then accessing the prevention methods, this is the basis of everything. You are absolutely right. That information needs to reach people, but this is not everything. We cannot say we let people know and the HIV epidemic will be resolved. So we need to find different ways to address different categories of the population, and this is also part of reducing the inequalities. We cannot depend on TV and say everybody will get to know, because inequalities mean that there are some people who do not have access to TV. Same thing for internet. Although internet and mobile technologies have proven to be extremely useful, particularly in the recent few years, the digital world, it has the potential to reach people who otherwise cannot be reached. And the level of and amount of information that they can access is important. So again, it's a combination. If we want to say about sharing information, it's a combination of approaches to share information with different categories of the society. But then some people need to know more details because by nature, they are probably more at risk, either by profession or by behaviors or by some vulnerabilities. And that additional knowledge helps them prepare more to be able to prevent being infected, but at the same time also accessing the treatment and the other services, including testing.
And finally, Mr. Bakkali, let's come to Pakistan. This is the country where we are talking to you from, and you are also the regional head of different countries that includes our country. When it comes to the response to HIV and the different measures that have been taken, how optimistic are you of the response that has come from Pakistan and the collaboration that has come from Pakistan as far as combating this pandemic, this, I wouldn't say pandemic, but epidemic together, that is HIV/AIDS?
I understand the situation and the epidemic of Pakistan very well, for having had the opportunity to work closely with several colleagues and stakeholders in the country. I see the tremendous political commitment. I see also the commitment to achieve and to respond to the epidemic. I see the commitment to bring in the communities and to establish partnerships. I see as well that there is financial commitment towards the response. And we have seen some data that tells us that beyond the funding that comes from external sources like the Global Fund, also there are domestic resources being done in the province, coming from the provinces and from the center towards HIV. This is really important. The challenge remains in building that infrastructure for a comprehensive response to go fast. So it's not an issue that nobody cares. That's absolutely not true. I saw that commitment by myself. It's an investment that needs to bring all stakeholders together to build that infrastructure within health. And we all know very well the challenges of capacities in the health system to deliver and to reach all people. For HIV, as well as the issues of blood safety, responding to outbreaks and all these things. But at the same time, we need to build that community system to deliver HIV prevention and information and linkage services, which has started over the past years, but need to be speed up. It needs to be scaled up very rapidly so that we can achieve that goal. Even the gap are quite large in the context of Pakistan, but I think it is feasible. If we go by the right approach, and if we go with in partnership, that it is not only health, and it is not only the HIV program in health. HIV is a multi-sectorial approach, from laws and policies to education to legislators to health, of course, and every social protection. All those components come together and bring in HIV at the center would help us get there by bringing all the partners together and being able to achieve. Because we understand, and in Pakistan, the analysis done, we have full understanding of who is vulnerable. So the design of the models of interventions to reach them needs to be scaled up.
Of course, the models of prevention, as you said, need to be compatible with the society that is in Pakistan. Absolutely. And the need to work together needs to be more aggressive from all the different quarters that are there with the United Nations, with UNAIDS, in order to combat this epidemic that we call HIV. Thank you very much, Taoufik Bakkali, Regional Director Asia Pacific for UNAIDS, to have joined us and to have talked to us in detail about what this day entails and this day means, and how can we end these inequalities and move together as one to combat this epidemic, so that by the year 2030, as you yourself said, you're very optimistic that we might be able to reach to an end of this disease that we call HIV. Thank you very much, sir, to have joined us.
Thank you for having me.
And now let's come to our last two stories, ladies and gentlemen. The first, of course, concerns the FBR that has beaten the tax target by 298 billion rupees. It has received 2.83 trillion rupees, largely because of higher sales tax collection at the import stage. Now, a lot of has helped because of the import and of course the rupee devaluation, but nevertheless the figures are very good. 761 billion in income tax in the first 5 months of current fiscal year, up by 179 billion. Over 114 billion worth of income tax was collected at the import stage. The income tax collection was higher by 56 billion than the target set for the first 5 months of fiscal year 2022. The share of income tax in total revenue stood at 33%, which placed increased burden of people, of course. Nevertheless, a lot of good things. The FBR recorded 41% growth in sales tax collection in the July-November period. It collected 1.05 trillion rupees in sales tax in 5 months, up rupees 302 billion. The FBR also collected 314 billion rupees in domestic general sales tax, compared with 337 billion last year, and therefore the figures are quite good, are quite healthy. And of course, we hope that this trend continues. And let's go to our next story, ladies and gentlemen, and that concerns Pakistan, that has been elected at the G77 at the United Nations. The G77 is, of course, a conglomerate of developing countries, and the 134 members that form part of it have selected Pakistan to head the G77. And Shami Qureshi Sahib, who is our foreign minister, also addressed this August ceremony and said that the world is confronted with a triple crisis: the COVID pandemic and its consequences, the challenge of releasing the United Nations Agenda 2030 for Sustainable Development, and the existential threat of climate catastrophe, which has a disproportionate impact on the developing countries. The Group of 77, ladies and gentlemen, was established in 1944, is the largest intergovernmental grouping of developing countries in the United Nations. Congratulations, Pakistan. And finally, ladies and gentlemen, let's go to Barbados, that has ditched the Queen. It was part of the British monarchy, and now it no longer is. Starting from Wednesday morning at midnight, it no longer was part of the British monarchy. Now, you know that there are different countries that are part of the British monarchy, that include Australia, Canada, and many other countries. Nevertheless, Barbados is no longer now part of it. And the first president of Barbados, Sandra Mason, said that we the people must give Republic Barbados its spirit and its substance. We wish Barbados all the very best, and we wish that it can stand up amongst the Committee of Nations in the years to come, free from the British monarchy. With that, we come to an end of today's newsroom. We'll see you inshallah tomorrow with new segments and stories that matter to us, you, and to Pakistan. Till then, stay safe and follow the SOPs. Get yourselves vaccinated. Allah Hafiz.